Cornelia. Just picking up from the last session, would like to go into talk about today 2 of the 12 core functions. I'd like to talk about screening and intake. And when talking about screening, which is the process of gathering information to determine whether or not someone is appropriate for your agency or program or whatever services you may be providing. With screening, there are 5 global criteria that I like to talk about because it's very important that you know this, because this is the beginning of the assessment. It is the beginning of building a rapport with your client. And with it having 5 global criteria, you can guarantee that there's going to be some questions on the test that's going to be wanting you to be familiar, be able to demonstrate competency and understanding screening. So number 1, like I said before, number 1 is gathering information and evaluating the information. You want to look at psychological, you want to look at social, you want to look at legal, you want to look at medical history. You want to gather the history to find out what's been going on with the client. You want to look at family history as it relates to substance abuse or mental illness, okay? You want to look at those histories. You want to know where the client is really coming from, how long they've been using, if they have built up a tolerance, if they have even had any prior treatment for substance abuse or mental illness. And not just limited yourself to just gathering information from that client. You may want to collaborate information from a family member. If they're on probation, you may want to look at that. If there's a lawyer sending them there, if there's a medical physician sending them there, you want to try to get as much information about this consumer as possible. Number 2, you want to be able to look at whether or not if the client is appropriate for your agency. When looking at appropriateness for your agency, you want to look at what type of treatment are they looking for? Are they looking for outpatient? Are they looking for inpatient, residential, detox? Because a lot of times clients they come into your facility and they, after talking for a while, they realize that they may be dope sick, they may be experiencing some type of withdrawals, they may be having some hallucinations. So if at that point, if they're experiencing those types of symptoms, then they may need to be referred to another agency. They may need detox, where, here at A.T.R.A Counseling Services is an outpatient facility where I provide individual and group therapy and family couple therapy. I do groups as it relates to guilt, loss, anger management, trauma, those types of groups. So a person experiencing withdrawals, they wouldn't be appropriate for A.T.R.A Counseling Service at this time. However, if I need to, if they are interested in coming to A.T.R.A Counseling Services, once they complete detoxification and they are interested in individual therapy only, then they would be appropriate for A.T.R.A Counseling Services. Number 3, when talking about eligibility, now there's a difference between appropriateness and eligibility. Eligibility, you're looking at the target population, You're looking at their funded resources, whether or not they're Medicaid, if they have private insurance. You're looking at you're looking at those types of things to figure out whether or not if they could afford the treatment. Is there fee for services? Are they in the if they're in the area where IPRS funds are, which that's a state fund that pays for clients who may be indigent, that's not eligible for Medicaid or Medicare. So that determines whether or not if they're eligible for your program. Now, when looking at number 4, we're looking at coexisting conditions, which could be physical, or it could also be mental, where a person may have high blood pressure and have not been taking their high blood pressure medicine. They may need to be assessed at their primary care physician to see whether or not if they have see if they need medication for their high blood pressure. A person may have been sexually active out there in the streets, participating in high-risk behavior. If they do not have a primary care doctor, they may need to go to the health department where they can be assessed for any sexual transmitted diseases, or even HIV, or these days hepatitis C, which is so hidden. And so that's very important to look at if they need to be assessed for some ongoing services, especially mental health. If someone is experiencing hallucinations, maybe having some anxiety attacks, maybe dealing with major depression and has not been taking any medication in quite a while, they may need a referral to a mental health facility. Okay, so we're looking at number 5. We're looking at adhering to the laws and regulations and policies that governs substance abuse treatment. So when looking at substance abuse treatment, it is very important that you, as the clinician, counselor, understands that that confidentiality, the client's rights, to know that no one can just call the agency and be able to receive information about a client without a consent form signed, an informed consent that has to be signed by you and the client. That is very important. And it's also important that you explain this to the consumer, that they have a right to know. You are to explain to them that this agency, that if the police wish to walk up into this agency at this point and ask for, if you are here, the agency cannot provide them with that information, because we are protected, and you are protected by federal law. It's CR 42. And so it's important that you know that, and that you have a full understanding of that law, that you don't, allow the police department to scare you to think that you have to reveal information about that consumer. However, in your treatment facility, it would be best practice that if you could have the skills and the knowledge to be able to communicate with your consumer, to build a rapport with your consumer, that you can encourage the client to turn himself in, for him to walk out there, to let him know that the police is out there. However, they can't just come in here, but it would be wise, it would be in your best interest if you go out there and let the police know that here I am, so we can get to that point, because you're in the process of recovery, and you want to straighten out your life. So this is an act of getting in the process of straightening out your life. And so do not be afraid of that. So that's screening. Which intake is just it's just another step that follows the screening. During the intake process is where you're having client, he's decided that yes, this is where I would like to be. I need individual therapy. For example, here at A.T.R.A Counseling Services, I need individual therapy. I'd like my family to be involved. And we'd like to, meet as a family as well, so I'm ready. Okay, so here's where I'm going to have the client. Number one, I'm going to have the client complete the required documents for admission to A.T.R.A Counseling Services, which is going to include him signing the client's rights, any forms to release information to his family members, his wife, his children, his probation officer, his primary care physician, anyone that he wants to be involved in this treatment, that he wants to let know that he's here. And so that is very important at that time, because that communication there is the beginning of dialoguing about who's going to be the support. He needs outside support, or she needs outside support to help make his treatment successful. So we can get all these people's names and have them sign all the necessary forms. We also going to have them sign the agreement for the treatment, because we want him to be committed to this. It's not just about this agency, it's about his commitment. So I'm going to have him sign the treatment agreement. Also going to have him sign the financial documentation that he's going to pay. This is where he's going to understand Medicaid's going to pay for it, or Blue Cross Blue Shield's going to pay, or Aetna, or Cigna, or Med costs, and also let him know what his copay going to be up front. And we also can talk about if he doesn't have the fee and he cannot afford it. We could talk about what's going to happen then. Because if he doesn't have any insurance, and with me providing services only for Medicaid and people with insurance, then I can refer him somewhere else that he could receive services for free. Or I can talk to him also about making arrangements. However, during this time, he has agreed for treatment, and so he's signing the documentation for the finance piece, and so that and still explaining to him about the appropriateness and the eligibility, letting him know that he fits the for appropriateness, because he lives here and he lives in Charlotte, Mecklenburg County. He's a male, which I see female and males. So he fits the criteria. And then I want to just solicit any information from him as to who else he think might want to be a part of his treatment. And go over once again about his confidentiality. Not just confidentiality as far as he's concerned, but anyone that he sees, if we're doing group therapy, anyone that's in the group, that it is confidential, that they're in this group, and that it is his responsibility to only talk about him when he leaves this room, and do not attach anybody else's name to who's here. Thank you very much. See you next session. So, good afternoon. I really did have this paper.
You were just going. You know this stuff. Go ahead.
Okay, so let's go. Okay.